All right, welcome to this video on strategies for choosing testing if you are relatively new to using Cyrex. I am going to be walking you through considerations for how to choose Cyrex arrays in the evaluation of autoimmune or environmentally induced autoimmune disease, and how you might bundle two or more of the tests together to get a broad overview or a deeper dive into a particular clinical condition. Okay, so the first part of appropriate assessment is taking a thorough history. It doesn't start with the testing. And some of the questions that we're thinking about as we are taking the history, and we'll be bringing this through into our assessment of which test to choose is it autoimmune? So perhaps your person already has a diagnosed autoimmune disease, in which case it is yes. But is there a question mark? Could this be an undiagnosed or developing autoimmune disease that we need more information to decide whether this is true or not? If it is autoimmune, where is the autoimmunity? So is it targeted just at a single tissue? Is it multiple tissue antibodies, tissue-specific antibodies in the single person? Because people with autoimmunity are at a high risk of developing a second or third autoimmune disease, or even potentially more. We see 4 or 5 sometimes clustered together. So once we know there is autoimmunity, do we know that it's in a single location, or are there more in the developing stage or undiagnosed stages, or does this person have multiple diagnosed autoimmune diseases? Then we're thinking about what are the barriers that are involved. So there are multiple mucosal and immune barriers in the body. We talk about and think about the gut a lot. We also have to think about the lungs and the sinuses and the nasorespiratory tract and the genitourinary tract and the blood-brain barrier. And then the 3 legs of the stool for autoimmunity are genetic predisposition, which we're not going to be using Cyrex to understand more about, and then immune system dysregulation and barrier permeability, which is part of the Cyrex assessment guide. And then lastly, what is the environmental trigger? So there are 4 categories of environmental trigger. We've got stress and trauma, and then we also have toxins, infections, and foods. Some other things that will be relevant to the conversation are whether or not the client or patient that you're working with were breastfed or bottle fed, whether they were born by C-section or vaginal delivery. And then we're also thinking about the family history. Is there a history of GI disorders or GI complaints in the family? Is there autoimmunity of any kind in the wider family? Is there a history of trauma? In the individual or also in the family? What about toxic exposure? We know that some of these toxic exposures can be passed down in the body from grandmother to mother to infant, coming through several generations. So toxic exposure in the individual that you're working with. Did the mother have any toxic exposure? Did the grandmother have any toxic exposure? And also, I want you to think about what is the family food culture. Is this a family whose food culture is diverse and experimental? Is this a family who views food as necessary only and doesn't like to cook? Is this a family that is eating only deep fried brown foods? Are they eating no vegetables at all? All of these will actually help us decide which tests we're going to be using or considering in the person that you're working with. Okay, so with Cyrex testing, we are taking a deep dive into the mechanisms underlying each person's autoimmune process. But in order to know which direction to take, we need to take a broader view and consider the big picture. So this is the Cyrex system, and within the Cyrex system, we are assessing environmentally induced autoimmune disease. So Cyrex has tests available in their suite of antibody arrays that look at the essential barriers. We have tests that look at the blood-brain barrier and also the gut barrier in a lot of detail. We have tests that look at antibodies, so autoantibodies, and this will help us answer the question, is it autoimmune, and or where is the autoimmunity? We have a suite of tests looking at environmental triggers. Specifically, we have multiple food reactivity panels, we have environmental toxin panel, and we have an infection panel. And it may be that you are obviously utilizing just one of those or two of those to start with, or you might need to do all of them to understand the environmental induction of autoimmunity. Then we have multiple panels that cover all of our bases here. So we've got a cognitive health assessment, which looks at the essential barriers and predictive antibodies and the environmental triggers. And then we also have a mucosal immune system panel, which also looks at essential barriers, autoantibodies, and environmental triggers. So all of our tests will fall into either one of those categories if it's a test doing a deep dive into one particular target subjects, or it will be a broader overview test that is encompassing all of the nodes on the diagram there to help us have a comprehensive overview of either the mucosal immune system or the cognitive assessment. Okay, so it is very important to me that you, the clinician, move away from protocol-based thinking. So it's never going to be, if you have thyroid autoimmunity, then you must do these tests, and it's always like that. I instead am going to be here to help educate you and guide you on how to think critically about each individual case. However, that being said, as you're getting started, there are a few combinations that you can consider while you are getting familiar and comfortable with the tests that we have and the questions that those tests answer. So I have put together in this video, in this presentation, some common clinical scenarios and some test combinations that might be helpful or useful in these situations. And you can see I've listed them out here, but I'm going to give you some more information about the clinical scenarios. So we're going to start with clinical scenario number 1 is using array 2, which is the intestinal permeability profile, array 3X, which is the gluten and wheat reactivity profile, and array 4, which is the dairy, gluten-free food, and top allergen profile, also known as the gluten cross-reactive panel. And we would use these tests together, 2, 3X, and 4, if we're suspecting that somebody has gluten-reactive autoimmunity, and that can include celiac disease, but is not limited to celiac disease. If we are suspecting food intolerances that are triggering extra-intestinal symptoms, such as fatigue or joint pain, that the patient is experiencing difficulty with compliance to the gluten-free diets or a similar diet intervention. I would definitely be considering these panels 2, 3X, and 4 in somebody who is newly diagnosed with celiac disease, or somebody with ongoing symptoms, somebody who has celiac disease but has ongoing symptoms after they've strictly stuck to the gluten-free diets, or a celiac who is struggling to stay on the gluten-free diet, especially in the early days of their diagnosis, and as a first step in a comprehensive autoimmune workup. Okay, so the next clinical scenario adds array 22 to the 3 panels that I discussed in the last clinical scenario. And this panel investigates celiac disease that was originally misdiagnosed as IBS, post-infectious IBS or post-infectious SIBO, where IBS or SIBO has been initiated by an obvious gastrointestinal infection or food poisoning. Where there is IBS or SIBO diagnosis with an autoimmune family history. So if somebody has not themselves been diagnosed with autoimmune disease, but they have a strong family history pattern of autoimmunity, and they themselves have IBS or SIBO. same thing, if they have IBS or SIBO, plus extra extra intestinal symptoms such as joint pain, skin rashes, and fatigue, or if they have IBS or SIBO diagnosis plus a concurrent autoimmune diagnosis such as Hashimoto's. Okay, next clinical scenario, we're looking at arrays 2, 10, 11, and 12. So I would be using this testing combination in somebody who has diagnosed autoimmune disease and they're already following a gluten and dairy-free or autoimmune focused diet, such as the autoimmune paleo or the Walls diet, but they're still symptomatic. I would be using this test combination on somebody who is newly diagnosed but happy to strictly comply with a gluten-free diet or an elimination diet, and they want to explore the remaining environmental triggers via testing. You can consider using this test combination if there are autoantibodies present on array 5 or on array 3X, but no diagnosis is available. Or if we're working with a practitioner and has addressed diet, nutrition, and lifestyle and seen improvements, but needs to take the next step forwards. So if we've made a series of common sense interventions and worked on the gut and worked on the diets, and done all of the things that are obvious, balanced blood sugar, worked on sleep, worked on stress, and made progress, but are now have plateaued or are coming up against a wall and can't continue to make progress, we can do a deep dive using this test combination to understand what is the roadblock and how do we continue to move forwards from here. Okay, next up is the bundle of array 2, array 5, and array 20. So I'd be using this particular test combination if somebody has a diagnosis of one or more autoimmune diseases, and we're looking to understand essential immune barriers and hidden or as yet unidentified autoimmune targets to guide interventions. To assure understanding and compliance of big picture strategy and with patients, and to track intervention outcomes. So this can also be followed up with array 3X, 4 and 10, or 10, 11, and 12. So array 2 is our mucosal barrier. So it's looking at different mechanisms of gut permeability and also lipopolysaccharide antibodies. Array 5 is our multiple tissue specific autoantibody panel, and array 20 is the blood-brain barrier. So it is a deeper assessment into somebody diagnosed with autoimmune disease. And this can then be followed up with 3X, 4 and 10 if we are looking to understand more about the role of food as an environmental trigger in somebody with an existing autoimmune disease, or 10, 11, and 12 if somebody is gluten-free, dairy-free, and we're just wanting to investigate the broader range of foods, environmental toxins, and infections. Okay. This next test bundle we're looking at is array 2, our intestinal antigen barrier antigen profile, array 7X, which is neurological autoantibodies, and array 20, which is the blood-brain barrier. And we would be considering this test bundle if somebody has got overt neurological presentation or diagnosis. If we're following up from previous array 2 and 5, or 2, 20, and 5 with only neurological antibodies present. So if somebody has run an array 5, which is the full antigen panel, and they only have neurological autoantibodies, then we don't need to run the full array 5 again. We can actually follow that up just with array 7X. We may be using this test bundle for assessments for early intervention when there is a strong family history of neurological autoimmunity. So we're wanting to the strong family history, and we are wanting to identify it as early, any changes immunologically as early as possible, so that we can make interventions as early as possible, which gives us a better prognosis. We can use this test bundle following any type of head trauma. So that would include accident, injury, that would include a sports-related injury, a car accident, whiplash, anything of that nature. I would also be considering this bundle if you are working with somebody with a mood disorder that doesn't respond as expected to first-line interventions. So we want to go ahead and see if there's any immune involvement in the mood disorder, especially if they're not responding to the usual interventions. Okay, RA2, our gut barrier test, RA10, which is our 180 food panel, and RA5, which is the tissue-specific antibody panel. We would consider this test combination if we're investigating autoimmune arthritis and the patient is already on a low allergen diet. So they're already gluten-free, dairy-free, or autoimmune paleo, or something like that. So we're not thinking about doing RA3 or RA4. Or we can use this test package as a follow-up in testing to assess intervention efficacy, basically to check up and see how our interventions are going and how they're working following interventions made after RA2, 3X, 10, and 5 in autoimmune arthritis. Okay, so next up we've got RA2, 10, and 5, and we might be considering using this bundle if somebody has got autoimmune diabetes and the person is already on a low allergen diet. Especially if they're on a low glycemic diet, but they're still getting elevated antibodies and disease progression. This can also be used as a bundle to follow up with testing to check efficacy following RAs 2, 3, 4, 10, and 5 in autoimmune diabetes. So very similar testing criteria and in fact the same testing bundle as we would use for autoimmune arthritis, but when we're specifically thinking about autoimmune diabetes as well. And then lastly, we are also thinking about whether or not we need to include total immunoglobulins, which is called our GAM panel. So GAM is total IgG, total IgA, and total IgM. And you can run this either at the same time as any other serum test or bundle it together with the serum, with the testing packages. Or you can run this ahead of time. This looks at total immunoglobulins in serum. This obviously doesn't include secretory IgA that would be measured in saliva. And we would use this test to assess suitability or to help us interpret the results for any antibody testing, which includes the Cyrex panels. This test can be added to any Cyrex order, or it can actually be ordered ahead of time. So you can order a total immunoglobulin panel if somebody is on medication that affects the immune system, for example. And then when your GAM panel comes back with everything in range and you have assessed that this person is an appropriate candidate for antibody testing, then you can add any of the serum arrays onto that sample. So the lab, Cyrex lab, will hold the sample for 90 days. And at any time during that 90 days, I would say up to day 89, don't do it on day 90. You can ask for the sample to be defrosted and to have any of the serum arrays run on it. So you can either do it ahead of time and then add the tests on later, or you can do it at the same time to help you interpret those test results. So in summary, we're going to be taking a thorough history. We are going to consider the Cyrex system of tissue antibodies, essential immune barriers, and environmental triggers. We're going to ascertain which information from the tests will best direct your immediate interventions. And then we're also going to ascertain which information will best support your client or patient compliance and their education about their own health. So I hope that's been helpful. Remember, you can book in with me for a technical support call via the Regeneris portal, and I look forward to helping you with test selection, with any questions that you have about using and understanding the Cyrex test, and also with test interpretation. I look forward to seeing you in person sometime soon.